I never fit. I was an alpha female, a sales executive that kind of just didn't fit in any box. When psychologists or somebody that I was in love with or whatever said that I was in the wrong body, I started to think, well, maybe I am. I'm a biological woman that medically transitioned to appear like a male through synthetic hormones and surgery. I will never be a man. Is it transphobic for me to tell the truth? Why is it that a couple hundred years from now, if you dug up my body, they're gonna go, yeah, that was a woman, had babies.
Can you tell me about the procedures that you had?
I've had 7 surgeries. I've had 1 stress heart attack. I've had a helicopter life ride with a pulmonary embolism. I've had 17 rounds of antibiotics. I had 6 inches of hair on the inside of my urethra for 17 months. Nobody would help me, including the doctor that did this to me because I lost my insurance. I get infections every 3 to 4 months. I'm probably not gonna live very long.
Was there any real discussion of the risks and the side effects and...
No, there's not. And I know that people want to think that there is, but there's not. The truth is that medical transition is experimental. We have studies that said that medical transition helps mental health with kids. They've all been retracted, modified, changed. But the only long-term study tells us 7 to 10 years is when transgender people are the most suicidal.
After?
After surgery. But that's transphobic to say. For the first time in history, a marginalized group has a huge dollar sign on the top of their head. We have 5 children's hospitals in the United States promoting that.
And what?
That's a phalloplasty. That's a bottom surgery. We have 5 children's hospitals in the United States telling girls that they can be boys at $70,000 a pop in a surgery that has a 67% complication rate. That will kill me from infection that I can't sue on. We're butchering a generation of children because nobody's willing to talk about anything. I have 3 kids. At the age that they're doing this to kids, I'm not transphobic. I love my kids, and I love other people's kids, and you should too. This is wrong on so many levels.
Can kids consent? Do you think kids are capable of consenting to this?
No, they're not. Being a parent is loving the hell out of your kids and helping them see around corners.
What's the youngest patient that you've operated on?
The youngest patient I've done vaginoplasty on is age 16.
Do you worry that minors just don't understand enough about themselves? They're not neurologically developed enough yet to make permanent life-altering decisions?
Absolutely not.
A young person's self-perception, one day they may be clear, the next day they may be totally confused and not sure. And you're affirming it with hormones that have never been used in this way in the field of medicine.
You're talking about puberty blockers?
Blockers and then opposite sex hormones.
At what age does the medical transition begin with medication?
So medical affirmation begins when the patient says they're ready for it. So that could be a kiddo who is just starting puberty and panicking because they're getting breast buds or their penis is getting bigger and busier and they're worried about all kinds of masculine changes. And that way, puberty blockers, which are completely reversible and don't have permanent effects, are wonderful because we can put that pause on puberty. Just like if you were listening to music, you put the pause on and we stop the blockers and puberty would go right back to where it was. The next note in the song just delayed that period of time.
You can just pause puberty.
No, you can't.
And then pick it up?
No, you can't.
In the future?
No, you can't. How many studies do they have, long-term studies, on hormone blockers with children? None.
I just spoke a month or two ago with a mother whose 14-year-old daughter was put on blockers. They discovered after 2 years, this 14-year-old girl has osteoporosis. That's something that like old women get.
How can doctors assure parents that a certain medicine is totally safe if, based on what you're saying, they can't possibly know that?
How can they be removing the healthy breasts of 15-year-old girls? How can they be sterilizing kids? How can this whole thing be happening, Matt?
Every child that they convince is transgender and in need of medical transition, it generates $1.3 million to pharma. And we're believing a pharmaceutical company, Lupron, hormone blockers, reversible, so they say. Well, the truth is that in 2003, Lupron was sued and deemed a criminal enterprise by the US government. They paid the most fine of any pharmaceutical company at that time, $874 million, wrote a check.
Is Lupron chemical castration?
Yes. We're giving it to pedophiles, aren't we? We're giving it to people that are dying, and we're giving it to kids, telling them that they were born in the wrong body and it's completely safe.
One of the drugs used is Lupron, right? Which has actually been used to chemically castrate sex offenders?
You know what? I'm not sure that we should continue with this interview because it seems like it's
that?
going in a particular direction.
Well, you're a medical professional,
I am a medical professional.
so you don't want to talk about the drugs that you give to kids, or?
Again, I'm a physician and I use medication. You're choosing exploitive words. Drugs I give to kids.
I'm choosing a
chemical
word
castration.
that was in a dictionary.
That's not a correct term for puberty blocking.
I could look it up on my phone, but I'm pretty sure if I looked it up,
You can look it up on your phone.
it says medical definition: the administration of a drug to bring about a marked reduction in the body's production of androgens and especially testosterone.
And I'm saying, as a pediatrician who takes care of hundreds of these kids, when you use that terminology, you are being malignant and harmful.
I mean, there are some who would say that giving chemical castration drugs to kids is malignant and harmful.
It's about the context of caring for a child and seeing the suffering that kids can have that have not been in affirmative home situations.
What do you say to the claim that, well, we have to do this for these kids because if we don't, they'll kill themselves. They'll resort to drugs and self-harm.
A lot of them were hurting themselves. A lot of them were suicidal before they even discovered gender. That is never part of the discussion. And they say, what would you rather have? A living daughter or a dead son? If this is what the professionals are saying, it's terrible emotional blackmail.